It's called the heart breath, H-E-A-R-T, and it's been heavily studied and used as a biofeedback technique for the last 30 years. So it's a very effective technique. And what it asks of you is that you imagine that you could breathe into your heart and out from your heart. That's all it is. So I'm going to ask you to picture your heart, your biological heart, if you like, or just the inside of your chest, if you prefer. Or I even had one professor at Stanford say, you could picture a heart-shaped balloon inside your chest. Doesn't matter. But what matters is that you focus on the area where your heart normally resides, which is roughly the center of your chest. And when you breathe in, you imagine that you're breathing directly into that heart or heart area. When you breathe out, you imagine that you're breathing out from that heart area. If you like, you can imagine that's in front of you. You can imagine the breath coming in from the front and out to the front, or you can imagine it in a circle around your body, any way you like. It also does not matter how fast or how slowly you breathe, or if you have an uneven breath. What matters is you keep your attention imagining you're breathing into your heart and out from your heart. Okay? Doesn't matter if it's through your nostrils or mouth, doesn't matter. The way it works is this. When you do that, what the studies have shown is that it increases a measure that's called heart rate variability. It increases heart rate variability. It has to do with how the breath and the heart are in synchrony or not. And you can optimize that synchronization. When that's optimized, the parasympathetic nervous system gets re-engaged. So if your mind wanders, you have one job, bring it back. I would suggest you do it for about 6 or 7 breaths. Personally, when I've done this, let's say if I wake up at night and I'm worried, I do the counted breath for 1 minute, I'll switch to the heart breath. I actually can feel things shift after about 5 minutes. Okay, so let's try it. To help you remember, I'm going to ask you to put your hand on your heart. You don't need to do that, but I'm going to ask you to do it today just so you remember that's where I want to keep my attention. Okay. And when you breathe in, feel your chest expand on the in-breath and feel your chest relax on the out-breath. And you can allow your eyes to close while you're doing this if it helps you not to be distracted. So on the next in-breath, breathe in and imagine that you're breathing into your heart. Breathe out. Imagine you're breathing out from your heart. Into your heart. Out from your heart. Into your heart. Out from your heart. And I know our rates of breath are different, so please continue on your own and do it for about 5 more breaths at your own rate. Notice where your mind is. If your mind has wandered, just bring it back. Breathe into the heart, out from your heart. Continue. And when you're ready, you can open your eyes and allow your hand to drop.